You obviously came to the presidency with a number of things that you wish to achieve. Perhaps we could run through some of those things, because many of them, I think, have become reality during the 2-year period of your presidency. Would you like to start perhaps by talking about SET, Surgical Education and Training?
Yeah, SET, Surgical Education and Training, was developed while I was Censor-in-Chief, and I was made the chairman of a working party to look at this possible reform. We became very concerned that there was some lack of interest by bright young doctors in training as surgeons, at least in some specialties. And when we looked at why that might be, there were various social and political and economic factors at work, and we could see that there were people who maybe wanted to become surgeons but were daunted by many years of training, becoming qualified at about the age of 35, and then having a career of maybe 25 or 30 years. And we thought that the training was too long, and we needed to do something to make it more efficient, and we needed to make it more attractive so that the best and brightest people would continue to be attracted to and actually enter training in surgery. So we set out to look at making it shorter and more efficient. And to do that, we needed to make it competency-based. We had to embed in-training assessment at various stages so that we made sure that people were progressing at the appropriate rate, and if they were not, to undertake appropriate remediation to help them, and we also needed a strong structure. We needed to start to use simulation skills laboratories to supplement clinical training opportunities. Perhaps the most interesting change was that we moved from a generic basic surgical training, followed by advanced surgical training in one of the 9 specialties. We changed to a selection into one of our 9 specialties right from the outset. And we also made it possible for people to be selected in their 2nd postgraduate year and to start at the beginning of their 3rd postgraduate year. So in brief summary, the selection is now directly into one of the 9 specialties, and it's shorter and it's competency-based. And we think it's going well. It's quite a challenge. It involves considerably more effort and commitment by surgical trainers, that is, surgeons training the trainees, because the time frame is shorter and there's a lot of assessment that needs to go on, and that has to be done professionally.
Technology must be an issue there. It changes so rapidly. Is that a key part of the surgical training process too?
Well, as you might imagine, in my 30+ years as a surgeon, there have been enormous advances in surgery and in other things that we do with anaesthesia and drugs and intensive care and all of the things that go together as a package to make surgical care more efficient. The training programs always have to keep up with advances in technology, and have up until the present time. In my field of general surgery, probably the biggest change in recent years has been a move away from open surgery with fairly large incisions, which was actually the only way that it was done 30 years ago, to increasingly what's called minimally invasive surgery, which is done through small incisions, done very carefully with good lighting, minimal blood loss, and quite often with telescopes and television screens. Surgical training, of course, keeps pace with all of that.